Hi, my name is Tim Birney. I'm a fellowship-trained orthopedic surgeon in practice at Western Orthopaedics for the last 25 years. I primarily treat degenerative conditions of the cervical and lumbar spines, while my practice in the last 10 years or more has also consisted of treatment of spinal compression fractures in a minimally invasive way. A spinal compression fracture refers to a fracture of the vertebral body, the cylindrical blocks of bone in the front of the spine, which results in loss of height of the vertebra. Prior to the early 2000s, the treatment of spinal compression fractures was fairly unrewarded, given that the only option was a combination of brace use, activity restrictions, symptomatic measures, and pain management. Many of these patients were elderly, frequently in poor general health, and had fractures due to osteoporosis. A common second group was patients who had cancer of the spine, who similarly tended to be very sick. The results with non-operative treatment were not ideal by any means. In the early 2000s, however, a company named Kyphoplasty brought to market a new, innovative, and minimally invasive technique for treatment of these fractures. This technique was called balloon kyphoplasty. For a time before its introduction, some physicians were treating spinal compression fractures by injecting bone cement into the fracture under X-ray guidance, a procedure called vertebroplasty. Although often beneficial, this technique made it difficult to inject a significant amount of cement. The incidence of cement leakage was a concern, and the procedure offered no ability to restore any of the lost height of the vertebra. Balloon kyphoplasty appeared to me to be a distinct improvement over vertebroplasty. Although both are done through small incisions in the skin on either side of the fractured vertebra, using thin metal tubes or cannulae placed into the back of the vertebra under X-ray guidance, the use of balloons placed in pairs into the vertebral body offers a twofold advantage. Firstly, the inflation of the balloons allows the opportunity to regain some of the lost height of the vertebra, thereby reducing some of the increased roundness of the spine called kyphosis. This particularly is the case in fractures treated earlier rather than later. That's where the term kyphoplasty comes from. Secondly, inflation of the balloons also creates two cavities into which the cement injection occurs, allowing for a greater amount of cement to be injected with greater stabilization of the fracture. The decreased pressure of cement injection into those cavities also means less force of injection is necessary, which in turn results in a lower incidence of cement leakage. The procedure is usually done on an outpatient basis under a short general anesthesia, although if necessary, it can be performed under local with IV sedation. The complication rate nationally is 1% or less. Most patients experience a substantial, fairly immediate level of pain reduction. Total healing time is in the range of 4 weeks, given that there may be still fractured areas within the vertebra not filled with cement that will heal with time. Patients are to observe limited bending, twisting, and lifting for 4 weeks post-operatively, but can otherwise be normally active. At that point, further rehabilitation is started, and I recommend the evaluation and treatment of the patient's underlying osteoporosis. The published literature contains many articles attesting to the safety and efficacy of balloon kyphoplasty. 2 articles, both published in a medical journal entitled The Lancet, are very relevant. Both contain patients randomized to a control group treated non-operatively and a study group treated with balloon kyphoplasty. The first article included only people with osteoporotic compression fractures, and the second only individuals with cancer as a cause of the compression fractures. In both studies, there was a statistically significant improvement in pain levels and overall measures of physical well-being and function in those treated with kyphoplasty compared to non-operative treatment. So I thank you for listening, and if you have further questions or concerns, please don't hesitate to check us out at our website, western-ortho.com. Thank you.